Hi there, this is my video for NU665D Week 2 discussion. It is a case study on benign GYN. So for HBI, I have Molly is a 30-year-old G0 presenting with complaints of irregular periods and pain to the lower abdomen and lower back radiating into both legs. Her pain starts the week before her menses and then subsides a few days after her bleeding starts. Her menses are heavy and she passes clots. Occasionally, her pain is so severe she must miss work. She is sexually active with her fiancé and uses condoms. She reports many years of dyspareunia, which seems to be worsening. She denies a history of abnormal PAPs and sexually transmitted infections. Her past medical history includes iron deficiency anemia. Her past surgical history is having her tonsils removed and wisdom teeth removed. She's currently on a multivitamin and vitamin D for medication. So the chief complaint would be irregular periods and pain in the lower abdomen and lower back radiating into both legs. For subjective data, I would ask any family history of GYN cancers, or breast cancers, and endometriosis. How is her diet and exercise? How often and what type of exercise does she like to do? Is she on any diet restrictions? Does she smoke? Does she drink or use any illicit drugs? How are her bowel movements? Any constipation, diarrhea, pain, any urinary symptoms like burning, itching, pain, abnormal discharge? How old was she when she had her first period? Are her cycles back then like what they are now? For her periods, I would ask if they were regular or irregular. Any skipping? How long does her menses last for? How many of the days are heavy? And on her heaviest day, how often does she change her pad or tampon? I would also ask what symptoms does she get with her periods, like cramping, bloating, pain, where if she does experience pain, and on a scale of 1 to 10, 10 being I need to go to the ER, how would she rate her pain? Does anything make it better or worse? Is she sexually active? Are her partners males or females? Is she in a monogamous relationship? What type of contraception does she use? Does she use condoms? And any pain with sex. So for objective data, I would like to do an abdomen exam and a pelvic exam. For labs, I would order a pregnancy test, blood work, specifically the CA125, an ultrasound to check for fluids or masses in the pelvic anexa area, and last resort, a laparoscopic surgery to get a visual detection of endometriosis, if that's the case. So, based on the subjective and objective information collected, I've decided to pick two differential diagnoses. The first one is secondary dysmenorrhea. So the diagnostics for that would be off her symptoms, the pelvic exam, and an ultrasound. For pharmacological interventions, I would prescribe 500 milligrams of Aleve at the onset of her period and take it as needed. So the initial dosing would be 500 milligrams, and then for maintenance, it'd be 250 milligrams every 6 to 8 hours. I would also like to start her on a birth control, orthocycline 28, to help manage the irregular period. For non-pharmacological interventions, I would educate her on the use of heat, diet, specifically a low-fat vegetarian diet, to increase dairy, exercise, counseling if she needs help, mental help, and acupuncture to help with the pain. I would also educate her to increase her vitamin E, B1, and D. On top of that, I would also educate her that if the pain continues, the next step would be to start her on a Lupron, which is a gonadotrophin agonist. And if that doesn't help, then the next step would be laparoscopic surgery to see what the underlying cause is. But I would reassure her we would take the steps before jumping into surgery. Referrals, I wouldn't have a referral, and I would like to follow up in 4 months to see how the period and pain is going. The second diagnosis would be endometriosis. So for diagnostic, the gold standard is laparoscopic surgery. For pharmacological interventions, I would like to talk to her about a long-acting IUD. I think that would help. Also, Lupron, again, for this one is a 3.75 milligrams IM monthly for anywhere from 3 to 6 months. For non-pharmacological interventions, it would be all the same as the dysmenorrhea. For education, I would educate her on what endometriosis is. So endometriosis is the cells of the uterus growing outside of the uterus. So when the cells become inflamed, that's what's causing your pain. It may cause scar tissues, which down the line would make it more difficult for pregnancy. And if all the treatment plans that we've tried are unsuccessful, and you don't desire to have a pregnancy in the future, a hysterectomy would be a complete treatment. Again, no referrals, and I would like to follow up with her in 2 weeks if she does go with the IUD plan, and if not, I would like to follow up with her in 3 months based off the Lupron. So for this week, I would like to add into my pocket guide the symptoms of endometriosis. It's very heavy on symptoms base, and it's hard when you can't physically see a diagnostic. So I just need a little reminder in my pocket guide. Thank you.